Hello, Dr. Kerr and class. The problem I wish to address in this paper and also in my scholarly project is medication compliance among individuals with mental illness. This is a worldwide and very widespread issue, but is especially prevalent in developed countries, generally because of increased access to health care and also because of more advanced diagnostic methods for these illnesses. Among all the individuals with mental illness, which currently account for about upwards of a quarter of the population, 40% of them are completely untreated. And of the 50% that are treated, they're generally non-compliant with their medication and ordered treatments. Directly, this issue affects the millions of Americans diagnosed with mental illness, with schizophrenia alone affecting more than 2.6 million Americans, and indirectly it affects all of society in general through increased healthcare costs, increased rates of violence, as well as violent crime, as well as a lot of divergence of state and federal funds to psychiatric facilities and healthcare. Increasing the number of compliant cases would decrease violence, violent crime, reduce alcohol and substance abuse, which generally go hand in hand with mental illness. Nicotine dependence alone affects 88% of individuals with mental illness. This would also reduce government and private financial obligations and even reduce homelessness.
Why is medication compliance among schizophrenics a big deal? This condition, when left untreated, can foster certain disastrous symptoms, self-injury, thoughts of or attempts at suicide, inability to work, isolation, homelessness, and aggressive behavior, among many others. Schizophrenia affects an individual's ability to clearly think and affects this individual's actions through symptoms of delusion, hallucinations, and disorganized cognition. Non-compliance can be destructive to personal relationships this individual may have and can increase the individual's likelihood to abuse alcohol and drugs, whether they be prescribed to them or otherwise obtained illegally. This specific demographic is often dual diagnosed with schizophrenia and substance abuse disorder, leading to detrimental lifestyle. Schizophrenics have a higher estimated rate for attempted suicide, placing it between 20 and 50%. Non-compliance not only affects the diagnosed individual, but the people around them as well. Society sees the effects of non-compliance in our crime rate and our tax dollars. Whether it be because of an increased schizophrenic symptoms or possible substance abuse, these individuals attribute to society's crime rate. A recent study looking at violent crimes perpetrated by individuals suffering from schizophrenia found that those that were treated with antipsychotic pharmaceuticals were 45% less likely to be convicted of violent crimes. While not all violent crimes are committed by individuals with this disorder, it is unrealistic to say all crimes will be eliminated if there is an increase in compliance. However, compliance with prescribed medications could result in a decrease of violence and crime. Schizophrenia has cost the US roughly more than 155.7 billion. This number is resulting from patient occurring hospitalization and crime due to non-compliance. Currently, less than half of all schizophrenics do not take the medications that are ordered for them. Past, past efforts. Educational handouts were often used and discarded quickly. Printed medication regimes were often ignored and unread. Available counseling was often offered but rarely used, and office phone numbers and emails are readily available to patients but again rarely used. The current population has a greater mistrust than ever in healthcare and practitioners that work within it. In 1966, surveys showed that over 70% of Americans had great confidence in healthcare practitioners, but the number has fallen drastically as the number stands at only 34% in 2012. This study even went so far as to state that only 58% of Americans consider their doctors trustworthy. Currently, around two-thirds of Americans distrust the healthcare system, and a little less than half distrust their doctors. It is also of note that these numbers have dropped considerably in the past 50 years. With the general public losing trust for doctors and with paranoia being a key symptom in schizophrenics, It is reasonable to assume that this subsect would have a greater distrust for physicians than an average individual. Trust is one of the most crucial elements in any relationship and necessary relation to communication. A patient physician relationship is key to the success of treatment. Both the patient and the physician can benefit from building a relationship that encourages patient trust. Having a lack of trust places an extreme disconnect between a physician and their patient, which can result in lack of communication. If a patient doesn't fully understand their diagnosis or the medications prescribed, they may find that the side effects associated with the medication outweigh the benefits and become non-compliant. When I collaborated with this project, I worked with 3 different individuals. The first was a seasoned psychiatrist because he has over 20 years of experience interacting with various individuals and with diverse diagnoses. He began his practice before many had access to mobile devices. I wanted to see if his perspective would lean towards what he's known or more towards today's modern way of living. He was found to be resistant and didn't see much of the point in implementing modern devices. Uh, he was stuck in the old ways and thought that his methods were very effective and they couldn't be improved upon. I didn't use much of his feedback, but I did appreciate any that he provided on my topic. Next, I look at a newly graduated psychiatrist because he was more accustomed to technology and he primarily worked and diagnosed mental health diseases. He has a good understanding of technology, and I wanted to see his perspective on its influence in healthcare. He was excited on the project, thought it would be good for physicians and staff to have access for quick communication with patients. He would like to implement the education of the app with staff and stress the importance of timely and quality responses to patient text. Next, I looked at patients that would use the app because I wanted to get the perspective of an individual that may or may not benefit from this application. I wanted their thoughts on if this application would be well utilized by any prospective patient. They were also on board the application, thinking but would like some education on how to use the app and thought that that would be a helpful introduction at the physician's office. Due to the increase in society's addiction and dependency on mobile devices, it can be easily presumed that a healthcare mobile application would be utilized. I have chosen the mobile application Scheduled. This application allows for healthcare professionals to send out text messages at scheduled times, increases accessibility to communicate with healthcare professionals, enhances the patient's quality of care, increases efficient management of their treatment plan, and advances the convenience and ease of managing one's condition. Having the ability to communicate with their physicians so quickly and effortlessly will allow for more personal relationships, leading to more trust, which could strengthen the physician's influence on these patients and more likely have their provided treatment plans adhered to. Treatment noncompliance is one of the greatest obstacles healthcare professionals are facing today. It is important to understand that these patients themselves play a large role in their hindrance to their own treatment, and it's up to the treatment physicians and their staff to institute interventions and educate the patient on how to maintain their treatment regime. It's in this way that I think Scheduled could help. It could send text messages to these patients at a predetermined time to remind them to take their medication and also to remind them of, say, doctor's appointments or other ordered treatments. And it would allow for effective communication between the physician and his team and the patients themselves. Let's see, treating physicians can utilize this mobile application to communicate medication reminders, treatment plans, and educational information to further facilitate the goal of medication compliance among schizophrenics. Beneficial recovery should be the goal of all patients, and it requires a collaborative effort between the patient and their treating healthcare professionals. Mobile applications will be a major asset in the efforts to produce optimum care for these patients, and it could be one of the largest determining factors of healthcare and medication compliance in the future.